Hey everyone, welcome to season 3. This is Shauna.
And this is Rosalina, and we're your hosts for Too Young for This Shit podcast. This podcast is not just about boobs, but a journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. Hey everyone, I'm your host, Rosalina, and this is the fourth and final Tit Talk of season 3. If this is your first time listening, this is a mini series where we dive deep into all things breast cancer news, bringing you the latest updates and vital information to keep you in the know. As always, I will link all the resources mentioned in the show notes. So for this episode, we'll discuss a new and exciting study where researchers ask, could breast milk serve as a tool for detecting and screening breast cancer? The objective of the study explores breast milk as a potential source of cell-free circulating tumor DNA, also known as ctDNA, for detecting early-stage breast cancer, especially during pregnancy or postpartum. Breast cancer diagnosed during these times tend to have poorer prognoses due to delayed detection and more aggressive behavior. The study was published in the journal Cancer Discovery in October 2023 and is the first time the link between breast milk and breast cancer detection has been analyzed. Researchers from the Vall d'Hebron Institute of Oncology in Barcelona explored this question by analyzing the presence of a cell-free circulating tumor DNA in pregnant and postpartum women. They put them into two groups, a control group of 12 women without breast cancer and a group of 15 women with breast cancer who were able to produce breast milk. We'll get into the results of the study and what this could mean for early detection, but let's start with an important question. Why did researchers decide to look at breast milk? To answer that, we have to look at the bigger picture. Typically, pregnant women or women in the postpartum period face a unique risk when it comes to breast cancer diagnosis. In fact, we actually aired a special episode this season where 3 mothers who were diagnosed while pregnant talked about the challenges they faced. In both pregnant and postpartum phases, cancer is often detected at advanced stages because conventional screening struggles to adapt to the changes in mammary glands during these periods. There is also a higher likelihood that both doctors and patients might overlook cancer symptoms and may think that the symptoms are related to pregnancy. Moreover, these women are typically younger and fall below the recommended age of 40, so they aren't usually undergoing regular screenings. As the study states, patients in these groups, quote, represent a population in dire need of novel, sensitive, non-invasive early detection screening methods to reduce mortality, quote. Okay, so why look at breast milk specifically? To understand why breast milk, we first need to discuss a diagnostic method called blood liquid biopsy. A blood liquid biopsy allows doctors to look for circulatory tumor DNA or ctDNA. ctDNA is a DNA that cancer cells shed into the bloodstream. To be clear, it is not a cancer cell, nor does it contain cancer cells. If you're interested in cancer cell detection in breast milk, there was a study published about it in 2020 that we'll link in the show notes. Typically, ctDNA can be used to detect breast cancer in metastatic patients. According to this study, ctDNA is detected in up to 85% of the blood samples of metastatic breast cancer patients. For early stage breast cancer, there isn't a presence of ctDNA in the bloodstream, or at least not enough of one for a blood liquid biopsy to be an effective detection method. That brings us back to breast milk. So, the real origin of this study starts with the mother diagnosed with breast cancer. She received her diagnosis during her third pregnancy and was worried that she'd pass her cancer onto her second child during breastfeeding. The researchers were able to assure the woman that her cancer wouldn't be passed through her breast milk, but they were interested in analyzing a sample of frozen breast milk she had saved from a year before diagnosis. Basically, the researchers had a hunch that the same principles that make blood liquid biopsies effective might work for a breast milk liquid biopsy. How cool! Currently, liquid biopsies are also used to screen urine for bladder cancer and saliva for head and neck cancer. Researchers hypothesized that since breast milk is in closer contact with the tumor than blood would be, even for early stage patients, the same principles as other liquid biopsies might apply and allow them to see the presence of a cell free circulating tumor DNA. Christina Saura, the first author of this study, head of the Valdebron Institute of Oncology, Breast Cancer Group, and Breast Unit at the VHIO, said in an interview with Oncology Central, quote, "Thanks to the mother, that's where our project started. When we analyzed the patient's breast milk, we found DNA with the same mutation present in her tumor." Quote. In other words, they were ready to test their hypothesis further and see if this liquid biopsy could help more mothers. So, how did researchers test breast milk for cell free circulating tumor DNA? Originally, the study, which is small, consisted of 19 patients in a group of breast cancer patients. 10 were diagnosed with breast cancer during pregnancy, and 9 in the postpartum period. Prior to testing, 4 women were excluded from the study, 3 had surgeries before childbirth, and 1 woman did not produce any breast milk. For the remaining 15 women, researchers used 2 techniques to analyze the breast milk: next generation sequencing and droplet digital PCR. Among these 15 patients, researchers tested their breast milk and detected mutations in the tumors of 13 women, compared to only 1 mutation detected by the blood liquid biopsy. For the 2 women who had no detected mutation, researchers concluded that because they had collected those samples during the first few hours of lactation, while they were still producing colostrum, waiting a slightly longer period before collecting samples could help improve the detection rate. So, what does this study mean for the future of breast cancer detection? The study opens the door for researchers and medical professionals to look at a new way of breast cancer detection that could detect cancer at a much earlier stage. With that said, you probably shouldn't expect this to be a widely used technique in the immediate future, as these are just initial results of a new detection method. However, these initial results have allowed researchers to initiate a much larger study to analyze breast milk samples from 5,000 healthy women worldwide who became pregnant past the age of 39, or any women who carry specific mutations that increase the risk of breast cancer. Overall, this study points to a possibly widened scope for the limited treatment options for pregnant women with breast cancer. Dr. Saura envisions that this non invasive test could be easily brought into a routine clinical practice. As she told Oncology Central, quote, "The idea would be to carry out breast cancer screening in women who have just given birth, in the same way that a small blood sample is taken from newborn babies to rule out metabolic disorders. We would take samples of breast milk from all women who give birth to rule out or diagnose breast cancer," end quote. So here are my thoughts. I believe this could serve as a valuable detection tool, and I think it's so cool they even thought that this method could work. And it indeed, of course, is just a small sample, but it is such a cool tool that I think that it should be introduced as a standard practice for young women who aren't regularly monitoring their breast for abnormalities. The cancer rate of young individuals is on the rise, which is why this detection tool can be life saving for many women, particularly for pregnant and postpartum women, as cancer tends to be identified at later stages with more aggressive tumors. But another question that I'm wondering is whether insurance companies would even include this detection method as part of a standard postpartum follow-up care for all women, which is another battle that unfortunately we might face. While this is still in its early stages, and I know that there was another study that brings in more women to test and examine. I really do hope that this detection tool captures the attention of many more oncologists, prompting further studies and advocating for its adoption as a standard care for all women, not just women who have a high risk due to family history. As we all know, 80% of women who are diagnosed with breast cancer had no family history. So I think that we need this standard of care for all women, not just those with high risk. So that is all the news for this week and wrapping up season 3. Thank you so much for listening to our Tit Talk this season. We'll be taking a break while we work on season 4, where you can expect more Tit Talks, guest interviews, and of course, real talk about what it's like to live with breast cancer. We'd also love to hear from you. We'll be releasing a short survey on your thoughts about season 3 and what you like to see in season 4. You can keep an eye out on our Instagram for more information. Finally, if you like to hear more about motherhood and breast cancer, be sure to check out our Mother's special episode that is live on Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks again for listening, and we'll see you next season.
A very special thanks to our podcast producer, Bethany Allard, and our podcast editor, Ayla Anderson.
Thank you all for listening and supporting our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoyed this episode, please share it with your friends and fellow breasties. Help us reach more women by subscribing and rating us on Apple Podcasts, Spotify, and now on YouTube. You can follow us on Instagram at TYFTS Podcast and email us at tyftspodcast@gmail.com. We love hearing from you guys, so shoot us a message. We will link any resources from the episode in our show notes.